There was a moment when all was known. You could feel.
Hi, my name is Sue Skasky with Vermont Volunteer Services for Animals Humane Society.
And I'm Lauren Skasky, also with VVSA Humane Society, and welcome to our show, For the Animals.
Today, actually, we haven't left since we did last week's show. Dr. Lynn Murrell from the Kedron Valley Veterinary Clinic in Woodstock came to speak about his adventure in Uganda with the silverback gorillas, and it was so fascinating. We just kept on going and going and going, and so we're only halfway through the interview, so he graciously agreed to stay and continue. Thank you very much.
You're welcome.
I know how busy you are, so I really appreciate it, but it's so interesting.
Mm-hmm.
Yeah, it's an opportunity of a lifetime.
Yeah, for sure.
You know, it's something that anybody could aspire to do.
You were talking about One Health. Would you talk a little bit about that again?
Yeah, One Health. The organization CTPH was founded on the principle that you don't have animal health and human health. You have One Health, and this has become recognized worldwide. And even in Vermont, we have some work being done in this area between human doctors and veterinary doctors. So One Health is the idea that we share a lot of diseases. A lot of the new human diseases come from animals, and in the case of the gorilla, it's so closely related to us. It's very easy for these diseases to pass back and forth. And so One Health basically looks at human doctors knowing more about veterinary diseases or diseases of animals and vice versa. Now, I know as a veterinarian, we're taught a lot about human diseases because we're humans and we're interested in that, and so we're taught a lot about that in school. And I think part of the gap is to teach us more and to also bring physicians into the loop and teach them a little more about the veterinary diseases and how these could be dangerous to people. In our daily lives, probably the one we confront most often is parasite diseases. Virtually all the animal parasites, have some form of expression in humans, and some of them are horrible. And if you go down to southwestern United States or into Mexico, there are tapeworm infestations that will kill people.
Oh, I remember years ago driving down to Florida and going through the Everglades. Mm-hmm. There was a dog on the side of the road. It was horrible looking at this poor creature. I stopped and it had mange.
Yeah.
And the poor thing was, he was beside himself.
Yeah.
And I tried to get him to come to me, he wouldn't. Mm-hmm. And I called and an officer came and he said, "There's nothing you can do for them." Yeah. I said, "Can't you at least shoot him?" I mean, the poor thing. To see this animal, I'd never seen anything like it before.
It's horrible.
Until Mariel.
Yeah.
But it was, oh my God, it was horrible.
Well, people in Vermont will often see a fox that has mange. And it's a very sad sight. A fox normally has this beautiful coat, glossy coat, bushy tail. One with mange has lost most of that coat and it's just replaced by scale and they die.
Is mange treatable?
It is treatable with a common drug that we use for a lot of other things. Ivermectin is the way it's normally treated in the wildlife population. I just happen to think, talking about wild animals in our area, another thing that can be fatal in our area is the raccoon roundworm. Roundworms, we think of in cats and dogs. Yeah, they're a little bit of a nuisance. It can be dangerous to people, but especially to kids who handle animals and don't wash their hands. But the raccoon roundworm larvae get into your bloodstream, and they often end up in your brain or somewhere like that. And by the time they discover it, it can either be fatal or it can leave you very seriously mentally incapacitated.
That's in people.
That's in people, yeah.
Now in the
and the raccoon, it's just a worm, so it affects his efficiency as an animal. But if it gets into people, it's not the right host, and it goes crazy, and it just gets in your body and it can do lots of damage.
What a way to go!
It can get in your eye, can get in your brain, can get in all kinds of places.
I know you're not going to remember this, but when Lauren was a baby, I had come to you with one animal, and I had her in the car seat, and I came right. I was like, "Oh my God!" Lauren just took the little syringe of the strontidy off the dashboard and sucked on it. And he said, "It's okay." That's what they used to give kids for pinworms.
For pinworm, exactly.
Do you remember?
No. You probably never had pinworms after that.
You just made me flash on that. Not that I'm laughing about the raccoons, but
right.
Wow.
Yeah.
Wow.
Yeah. So, if somebody wants to take in that cute little baby raccoon, to raise it up, and they don't want to teach the kids about it, and the kids want to play with the little baby raccoon, and then they stick their fingers in their mouth. big risk. So that's
Wow.
why, wildlife are wild, and we should respect their wildness and
Yeah.
not try to treat them as pets.
We've had a couple, Nancy Carey's been down, and we've had a couple other wildlife rehabbers down here who have talked about the importance of leaving wildlife in the wild.
Yeah, very important.
Yeah.
Yeah.
So,
But this is part of One Health, If the physician doesn't realize that a raccoon roundworm can be fatal to a human patient, and somebody comes in with symptoms, from a raccoon exposure to raccoon roundworm, you may lose weeks of valuable treatment time.
yeah.
It's just, if I remember one time treating a bunch of cattle for a type of skin parasite. In fact, it was a type of mange. And I look over, and the kids have got little lesions on their arms, and so I started talking to them. and said, "Yeah, we went to the doc, and they had ringworm. No, it was ringworm. Yeah, they had ringworm. We had them treated." I said, "Guess what? Your cows have got it. Guess where the kids got it?"
Yeah. Do you remember after we did the case in Heartland years ago? I ended up with ringworm on the tip of my nose.
Sure.
Do you remember?
Yeah.
That was a
Yeah.
nightmare of a
Yeah.
situation.
Yeah, so that's One Health is the idea that we all need to keep up with what goes on in the other half. The people in the health professions, what goes on in the other half, because they are very closely related.
It's good to hear it's coming to Vermont.
Yeah. There's going more to be done. It's being done pretty much between the physicians, the pediatricians, and the veterinarians. And I haven't been to one of the meetings yet. My daughter went to one, and then there was one in Rutland I was going to and didn't get to go to. But I'm going to try to get more involved in that because it's really important.
Yeah, for
Really
sure.
important.
Can you tell me what you've done in your visits to Bundy?
Well, I've been to Bundy twice. First time I was kind of the newcomer, so
Observing.
I got the village tour. We
Yeah.
walked around and I learned a lot about this organization. Spent some time in the lab, learning how they do their tests and so forth. Basically, the monitoring of the gorilla health is done, a lot of it through fecal analysis. The rangers, they can actually tell when they see where an animal has camped. They can tell by the feces which animal it is. Now, you tell me, you talk about
Wow.
recognizing individual animals. They can look at that pile and say, "Oh, that's
I know
Susie's,"
who that
because.
is.
But anyway, they collect these fecal samples and bring them into the lab, and then they examine them for parasites. And when they get their new facility built, which we'll talk about later, they're going to be able to do even more types of diagnoses and so forth. So I was kind of learning about things like that. Then the second time, which was in February of 2010, I basically took over 500 doses of canine rabies vaccine. And the idea was that, again, we don't want rabies getting into the gorillas, and the way you do that is you keep the dogs healthy. And so what got this started was we had learned that the previous year, 6 or 7 humans in the area of this 2,700 households had died of rabies.
Wow.
And so we got to talking to the public health people there, or the veterinary public health people there, and they have a program of vaccination, but it's in December of every year, but they don't get all the dogs. And some people don't come down to get them vaccinated, and in this particular case, in the end of 2009, they actually ran out of vaccine. So this 500 doses, we could have used a lot more, but we just didn't have the capability of carrying more, was to pick up in February and get those dogs that weren't vaccinated in December. And so we did quite a few dogs while I was there, and then they kept the vaccine and continued on the next month to get as many more as they could. So I felt kind of funny when I was giving a rabies vaccination to a dog there. I thought, I could be saving a human life. Yeah. I mean, I'm not just protecting this dog. Around here, we give rabies vaccines every day. We don't think anything about it. Yeah, you got to do it. It's the law.
Right.
We don't want dogs having rabies and biting kids, so forth.
Yeah.
But I'm thinking, I quite literally could be saving a human life by vaccinating this dog. So, it really was very sobering. So that was part of what we did was that. We also took surgical equipment with us. And this was Dr. Gladys's idea, the head of CTPA. She said, we should neuter a few dogs, or spay a few dogs. So we said, okay. So we took all the equipment and the drugs and everything we needed. And so when we'd have everybody there for the rabies clinic, we'd say, well, does anybody want to have their dog spayed or neutered? Well, nobody wanted to have their females spayed, because where are they going to get new dogs? Because the lifespan of a dog there is not that great. They don't have constant veterinary care, so they don't live too many years. They have a great life. They get to go out and catch all kinds of wild things to eat, but they don't live forever. So they don't want those females spayed. But they said, but this dog's always wandering off. Could you neuter him?
Really?
So we castrated several dogs. It was really interesting. Usually I remember one time they brought out we've got pictures of this, which you'll see in a minute. They brought out a church bench a bench from the church and set it up there in the field. It was on the soccer field, edge of the soccer field in the middle of the village. And we knocked the dog down, got him tied back on the church bench, and we're all down on our hands and knees neutering this dog, castrating this dog. And Dr. Gladys, who I said had fantastic training, hadn't been doing much of this. She's dealing with gorillas, So she jumped jumped right in, and before we were through, as a second dog, boy, she was right in there, neutering away.
Now, do they have cats there too?
Not very many cats. I was kind of surprised about that.
And, okay, do they have a problem with overpopulation of animals like we do?
It doesn't seem to be a problem. Dogs are very prized. People take care of their dogs. When the first year I was there, we went around to several farms and talked to farmers and, heads of household and so forth. And I remember saying something to one farmer, well, what do you feed your dog? And he says, well, if we have scraps, he gets scraps. But, and I said, well, what do you feed him? He said, well, hey, he feeds himself, He said, one of the reasons we have dogs is to keep the rats at bay. And the other is for security. So if somebody wanders around your dwelling in the middle of the night, that dog's not going to just sit there and wag his tail.
Right.
He's going to bark.
They've got a job.
Yeah, they got a job. So they control the rodents and so forth. So the dog goes out and scrounges for himself. So he gets a good diet, And maybe he gets a toss out of the whatever's left, but they don't leave too much in their plate.
Yeah.
So the dog he kind of goes on his own. But they really value their dogs, and I didn't see. Now in the city it would be different, but out in the rural areas I didn't see stray dogs. Occasionally we would see a cat, but not a lot of them.
Do all the dogs look alike?
They all look alike, and in fact, I think one of the pictures that will show of one of the rabies clinics, they're lined up, and you look at them like, how do you tell those dogs apart?
How do you tell the gorillas
They're kind
apart?
of like a little dingo dog, They're all about the same, about 40 pounds and short hair, and of course we're talking about an area that's right on the equator, so long-haired dogs would have a rough time here.
Yeah.
But they're cute little dogs and very friendly, and they weren't too sure they wanted to get shots, but we worked out a technique of giving a headlock between your knees to the dog while somebody came up behind and shot them, and tried not to shoot the person doing the headlock.
Well, you've got that down to an art by now.
Yeah, right, exactly.
Tell me, what was the most exciting part of your trip?
Well, I have to say the most exciting part was when my wife, Judy Hills, came down from the area she was working in Hospice, Uganda, and we did a gorilla track they call it. And basically you have to get reservations, in most cases a year ahead. Dr. Gladys was able to, because of knowing the people at UWA, was able to get us passes, people who'd canceled out. So we got these passes, and on the appointed day we showed up at the camp headquarters, the park headquarters, and they gave us an indoctrination and showed us a video of what to expect. And then we get our packs on our back and our water bottles and head into the forest. And fortunately, there's a kind of a service road that we were able to cover quite a bit of the distance, probably about an hour we went in on the service road. And all the time, the woman who was leading us, the ranger, she's a woman ranger, she was in fact the first woman who became a trek leading ranger. She had been a tracker before that. Well, she was in communication with the trackers, and the trackers are out ahead. And what they've done is they've gone to where the gorillas slept the night before, and then they've gone through the broken brush and followed them until they find them. And these guys know this country, even though you can't see more than 100 feet, they know it like the back of their hand. And say, well, when you get to the such and such tree, turn down this ravine and so forth, and head over this hill and so forth, and you'll find us, And so, no maps or anything. So we're wandering up and down these steep ravines, slip sliding and everything, because this is rainforest. And eventually...
Are you walking or driving?
No, we're walking. No, this is all walking.
Oh,
So it took us about 2 hours to get into where they were. And so we were going along, and suddenly the ranger says, well, we're here. And said, oh, good, we'll get to see the gorillas pretty soon, And so there was this long silence, and somebody said, well, when will we see them? They said, well, turn around. And turn around, and there's a mother gorilla sitting there 20 feet away, just munching away on leaves and so forth. And from the next hour, we're allowed to stay there for an hour, we'd move around this group of gorillas. I think there were around 20 in this group that we saw. And we would just watch them. And they couldn't care less. They had been taught that humans are harmless and so forth. We watched the little kids playing together, just like two human kids to watch.
Are these animals protected under law?
They are. And fortunately, because of educating people around there of the value and of these, really critically endangered